For some time, Uganda has been hailed as a global success story in the fight against HIV and AIDS since the first case was discovered along the shores of Lake Victoria in the 1980s. Since then, there have been numerous attempts aimed at curbing spread of the disease. Dr. Jacqueline Makoka, the country representative UNAIDS, has challenged the community to take lead in the fight against prevention of HIV/AIDS. This as she was addressing the media in Kampala ahead of the World AIDS Day, with festivities to be held in Rakai district on December 1st.
This theme reminds us of the importance of community leadings, and that when communities lead, we make progress. This World AIDS Day is more than a celebration of the achievement of communities. It is a call to action to enable and support communities in their leadership roles.
According to the Ministry of Health, about 1.4 million Ugandans suffer from HIV. About 17,000 people die annually, most of them men. Dr. Watiti Stephen, the former chairperson of the International Forum of People Living with HIV, called upon the public to seek treatment immediately they test positive to the virus.
How do we lead? And I want to say this, that as communities we know, again from statistics, that there are still new infections, unfortunately. We get about 1,000 new infections every week, which translates into over 50,000 new infections every year. Now this is not good, because we want to stop this disease. That means you should turn off the tap of new infections, and the community that should lead are you people who are not yet infected, everybody, and especially people who are getting most of these new infections. And again, they tell us that it's adolescent girls and young women. If you check, the new infections are affecting this. So I want all adolescent girls and all young women to take the lead on this, to ensure that we get no new infections. As for living with HIV, it is not in our interest to get any other new infection.
Efforts at positive living are still affected by stigma within communities.
Communities of adolescent girls and young women. These are communities of women living with HIV and male partners as well. The question to us all would be, what does it take for us to ensure that these communities actually lead as we would love them to? But it also questions us, what has been the barrier or the hindrances as to why these communities are not leading as yet. One of the things I cannot fail to speak up to, like Doctor mentioned, is the issue of stigma and discrimination. You cannot expect a young person living with HIV to come out and lead when they actually expect to be discriminated against, to be isolated in the communities that they thrive in. Secondly, we could also look at the low levels of treatment literacy. When Doctor mentioned about adherence, there is no adherence if you cannot understand the kind of medication that you're on. And if you're not taking the medication, obviously you will succumb, like you mentioned, and you'll lose your life, thus not being able to live.
The struggle is largely donor-funded, necessitating deliberate efforts aimed at locally raising the required funds.
One of the areas I would like us to take note that although we've had this progress, new infections still pose a threat. And that's the reason we come to you and we come to bring this message to Ugandans, that unless we take it upon ourselves and recognize that the threat of new infections, the science is there, we know how to protect ourselves. You need to know your HIV status, but if you do not take the leadership to know your status, to protect yourselves, new infections are still there. That's why we are having 1,000 new infections every week, and they are affecting predominantly young people between the age of 15 to 24. And when you look amongst the girl child specifically, the infections are even 3 to 4 times higher than their male counterparts because of the societal dynamics, because of transgenerational sex and transactional sex. So sex involving exchange of money. When I give you money, you become weaker in terms of bargaining. It will be difficult for the person who has received the money to ensure that they bargain for protection. When it's transgenerational also, the older individual is exercising power over the young one